Well, nationwide vaccination efforts for COVID-19 aren't happening as fast as planned, but doctors have another problem on their hands, which is many people of color don't want to get the vaccine. WMAR-2 News' Mark Roper is live this morning with the details about a virtual town hall to address these concerns. So, Mark, how exactly do they plan to convince people that this vaccine is safe?
Good morning, Megan. Well, doctors want to help people face their fears head on, so several healthcare professionals with the University of Maryland Medical System will be available later this morning to hear people's concerns and answer their questions about the vaccines.
The arrival of a vaccine for COVID-19 couldn't come soon enough for most, while others need more time to be convinced before getting a shot in the arm.
There are some that we know we may not change your mind and accept that. But we want to make sure that everybody that is still searching for facts, still searching for, confirmation of a decision, we're here for those people.
The Black and Latinx communities have been hit hard by the virus, but besides inequities in healthcare, many African Americans believe history has given them a reason to mistrust the vaccines. So far in Maryland, the number of Black people who have gotten the vaccine is only about 25% of the total number of whites, and for the Latinx community, it's only about 7% of the total number for whites.
This vaccine is a major breakthrough, a scientific miracle that is going to allow us to beat this pandemic. And for those that getting tired of masks and not seeing your families and congregating, this is the path forward.
Chief Medical Officer at the University of Maryland Upper Chesapeake Health, Dr. Fermin Barreto, can count himself as one who has been vaccinated.
I took the vaccine for my family, my parents that are above, that are 75 and 78. I'm a father, a son, a brother. I did it for, my hospital and the position that I'm in here.
Dr. Barreto believes one of the next steps to getting more people vaccinated begins with answering their questions about the vaccines.
Welcoming every single solitary question. The microchip question, the infertility question, the DNA, changing my DNA, all of those. You have to start with those.
Doctors taking part in a virtual town hall put on by the University of Maryland Medical System hope to address those concerns one by one.
Women in childbearing age, that's a real concern. American College of Obstetrics and Gynecology has come out that the ingredients contained within the vaccine, there is no contraindication to receiving it. But I can't combat the fact that it has not been specifically studied.
Doctors also are focused on combating the fear of allergic reactions.
Just let them know that it's real. Let them know that the allergic reaction rate is actually quite low. You begin to, change those minds.
It's just one goal of the town hall.
It'll be such a shame if we can't get enough people to take the vaccine. It's like refusing a cure for cancer or refusing a cure for whatever ailment you may have.
Which is why doctors are ready to listen to those who don't want to get vaccinated.
You want to hear the reason that they are concerned, afraid, or hesitant. I mean, if you don't understand that, then you'll never be able to connect.
Now, the panel session is being led by doctors, many of whom are also people of color. It starts at 11 o'clock this morning and runs until noon. So if you've got a question about the vaccines you'd like to ask a doctor, just look for a link to how you can watch that on our website, WMAR2news.com. Reporting live, Mark Roper, WMAR2 News.